This is my student support system. Keep watching, keep learning.
Hello, welcome to my student support system. In today's class, we are going to discuss a very short but very important topic for your exam point of view, that is fetal circulation. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel my student support system. First of all, we should know what is circulation of blood. The blood circulation is defined as the flow of blood through blood vessels to different parts of the body. There are four types of blood circulations that we study in human body. These are pulmonary circulation, systemic circulation, fetal circulation, and portal circulation. In today's class, we are going to discuss about fetal circulation. Fetal circulation is slightly different from adult circulation because the lungs of developing fetus are inactive. Fetus obtains its oxygen, nutrients, and excretes its waste via mother's blood. This exchange of these nutrients and oxygen take place at placenta. The blood flow from placenta to fetal tissue through the fetal heart and then back to the placenta. This cycle is known as fetal circulation. This is a there is a temporary structure. What? The placenta. This is a temporary structure in the uterus, and the growing fetus receives its oxygen and excrete the waste products through the placenta. The placenta is firmly attached with the uterus or uterine wall and consists of extensive network of capillaries. The fetal capillaries bath in the maternal blood in the sinuses. This is the placenta, and you can see that this is the place where maternal blood is circulating, and these villi from the fetal blood circulates here, and exchange of gases and nutrients take place. Then this blood goes towards the fetus through umbilical cord. This is the basic structure of the placenta. Actually, the maternal blood and fetal blood never meet each other. There is a thin layer of a very single layer membrane through which exchange of gases and nutrients take place. So the there is barrier between placental blood, or we can say maternal blood, and fetal. One umbilical vein collects oxygenated blood. Okay, so normally we study that all the veins contain unoxygenated blood, but placental or umbilical vein, which comes from the placenta towards the child, it contains oxygenated blood from placenta and then travel to the infant through umbilical cord. There is a special vein known as ductus venosus. This is the ductus venosus, which is continuation of umbilical vein. So umbilical vein coming from the placenta, and then normally this vein takes blood through liver, but here there is a bypass, and this bypass is known as ductus venosus, and blood is directly transferred to the inferior vena cava. This vein, ductus venosus, pour oxygenated blood coming from placenta directly into inferior vena cava. So through this picture you can understand. In this way, oxygenated blood coming from placenta bypasses the non-functional fetal liver, and then fetal inferior vena cava pour oxygenated blood into right atrium of the fetal heart. Okay, while in the adult, this vena cava, inferior vena cava and superior vena cava, they contain unoxygenated blood, but in fetus they contain oxygenated blood. So this oxygenated blood comes into the right atrium. Okay, there are two special adaptations in fetal heart to bypass the lungs, because lungs are non-functional and this blood is already oxygenated. So first is foramen oval. So this is foramen oval. It is a temporary opening between both the atrium. Okay. So the oxygenated blood which has come from the placenta directly enters into the left atrium. Okay. But slight amount, very less amount goes into the right ventricle. This arrangement is to bypass the lungs. Second arrangement is ductus arteriosus. What is ductus arteriosus? This is a small vessel which connects pulmonary artery to the descending thoracic aorta. So this is the pulmonary artery. Okay. So normally from the uh, right ventricle blood goes into the lungs, but here there is a temporary arrangement ductus arteriosus. So this blood is already oxygenated, so it directly enters into the aorta, and majority of amount comes through the left ventricle to the aorta. Okay, so in this way the blood bypasses the lungs also. Oxygenated blood now pumped into the fetal circulation, and all the cells of fetus receives oxygen, nutrients from mother, and excrete carbon dioxide and other waste products into this blood, which again goes into the placenta. How it goes into the placenta we can understand by this picture. Two placental arteries from the internal iliac artery carry the less oxygenated blood through the umbilical cord. In this way, fetal circulation is completed. So here two arteries which goes around the umbilical vein. So this is umbilical artery and this is the umbilical vein, and this reaches to the placenta, and again the cycle starts. So this is all about fetal circulation, and to summarize we can understand the fetal circulation through this picture, that through from the placenta through umbilical cord, one umbilical vein and two arteries are there in the placental cord. The oxygenated blood comes via umbilical vein, and then first adaptation is ductus venosus. Through this the blood directly enters to the into the inferior vena cava. Then from the inferior vena cava blood directly enter to the right atrium, and through right atrium there is foramen oval, and through this opening foramen oval, yeah, oval foramen, the blood directly enters towards the left side of the heart, and then it goes into the systemic circulation of fetus, and the small amount of blood which is in the right atrium, right ventricle, this goes directly into the aorta through ductus arteriosus. Okay, so in this way liver and lungs are bypassed, and then while coming back the deoxygenated blood or less oxygenated blood through the umbilical arteries goes into the placenta. This is fetal circulation. Now we will check what changes take place at the birth in the circulation. When the baby takes its first breathe, the lungs inflate first time and increasing the pulmonary blood flow. The blood returning from the lungs increase the pressure in the left atrium and closing the flap over the foramen oval and preventing the blood flow between the atrium and foramen oval closes. The blood entering the right atrium is therefore directed towards the right ventricle and then it is pumped into the pulmonary circulation through pulmonary veins. And at the same time, as the pulmonary circulation is established, blood oxygen level increases, causing constriction and closure of the ductus arteriosus. When the placental circulation ceases soon after birth, the placental vein, ductus venosus, and umbilical arteries collapse as there is no longer required, and then they completely shut off. So this is all about fetal circulation. For more such lectures, you can subscribe the channel, and for making your notes, you can visit mynursingstudents.blogspot.com. Here you can find all the notes. You can follow me on Twitter, Instagram, and Facebook group Nursing Notes. Thank you. Have a nice day.